Most activity intolerance is related to generalized weakness and debilitation, secondary to acute or chronic illness and disease. This is especially apparent in older patients, with a history of orthopedic, cardiopulmonary, diabetic, or pulmonary-related problems. The aging process itself causes reduction in muscle strength and function, which can impair the ability to maintain activity. Activity intolerance may also be related to factors, such as obesity, malnourishment, anemia, side effects of medications, or emotional states. Nursing goals are to reduce the effects of inactivity, promote optimal physical activity, and assist the patient with maintaining a satisfactory quality of life. Activity intolerance, definition: insufficient physiological or psychological energy to endure or complete required or desired daily activities. Activity intolerance related to imbalance between oxygen supply and demand, possibly evidenced by reports of fatigue and weakness, abnormal heart rate or blood pressure response, decreased exercise or activity level, and exertional discomfort or dyspnea. Generalized weakness, deconditioned state. Sedentary lifestyle or prolonged bed rest. Insufficient sleep or rest periods. Depression or lack of motivation. Imposed activity restriction. Pain. Side effects of medications. Activity intolerance, subjective data. Verbal report of fatigue or weakness. Unable to endure or complete desired activities. Exertional discomfort, dyspnea. Activity intolerance, objective data. Abnormal heart rate, blood pressure, or respiratory response to activity. Electrocardiographic changes reflecting arrhythmias or ischemia. Activity intolerance, expected outcome. Patient exhibits tolerance during physical activity, as evidenced by rating of perceived exertion of 3 or less, on a scale of 0 to 10, heart rate less than or equal to 120 beats per min, systolic blood pressure within 20 mm Hg, increase over resting systolic BP, respiratory rate less than 20 breaths per min, absence of chest pain or dyspnea. Patient reports ability to perform required activities of daily living. Patient verbalizes and uses energy conservation techniques. Participate in prescribed physical activity, with appropriate changes in heart rate, blood pressure, and breathing rate. Maintain electrocardiogram monitor patterns within normal limits. State symptoms of adverse effects of exercise, and report onset of symptoms immediately. Maintain normal skin color, skin is warm and dry with activity. Verbalize an understanding of the need to gradually increase activity, based on testing, tolerance, and symptoms. Demonstrate increased tolerance to activity.